Chapter 6. Claim Preparation and Transmission. When a prescription is to be billed to any sort of insurance or third party for reimbursement, it is said to be a claim. Thankfully, technology allows us to file these claims electronically. All prescription claims should contain these 5 components at a minimum: the patient information, prescriber info, pharmacy, insurance, and prescription information. Within these 5 categories are even more specific items that must be included, which we will discuss further. You've already practiced gathering all of this information in your community pharmacy class. Making sure it is entered into the computer correctly makes transmitting a claim easier. Sometimes, if a date of birth or some other common piece of info is incorrect, the claim will typically reject and tell you what is wrong. Name, gender, and date of birth are the most vital pieces of information for the electronic claims. However, other pieces like address or phone number are helpful if the pharmacy needs to contact the patient somehow. When entering a prescription, double-check that the prescriber's DEA or NPI numbers are correct and match up, and also that their name is spelled right in the computer. Many computer systems these days contain prescriber lists that have been pre-verified to have this information be correct. However, you may still at times be required to enter this info as new from scratch. Don't be afraid to ask someone else about spelling or to read the DEA number, and also don't hesitate to call the doctor's office if any of this information is illegible. Every electronic claim you process will automatically contain the pharmacy information, so you likely won't ever need to actually enter it anywhere. However, it is important to simply know that this information is present. Every pharmacy has an NPI number, and some insurances request this number when processing and resolving issues. As a pharmacy tech, being familiar with the insurance information of patients will be one of the most common and important tasks you will be asked to do. When entering patients' insurance information into the computer, the BIN and PCN numbers will be the first pieces of information you look for. These numbers help to narrow down the specific insurance carrier and plan that they have. After you select the correct BIN and PCN numbers, you can then start entering the patient-specific fields like ID number and group ID. After you've already ensured that the accuracy of the prescription info that you've entered and transmitted to the insurance is correct, they or the PBM will look at the drug and similar associated fields to determine the validity of the prescription and assign the correct benefits.